So again, it is very important to know the life cycle of each parasite. Specifically, you need to understand the infective stage of the parasite, where it infects, and which tissues or organs it eventually passes through as they go through their developmental life cycle. It is very important to understand the route of infection from the infective site through the exit site. And the reason for understanding the route of infection is you need to understand what are the signs and symptoms associated with the different stages of the parasite inside the human, as well as the different organs and tissues affected in the life cycle of that particular parasite. You have to be able to correlate which signs or symptoms correspond to which infective or which stage in the life cycle and which tissues or organs are being affected. And of course, as future medical doctors, we all have to understand what we need to see or to know in order to diagnose a particular parasitic infection. And that is where the diagnostic stage would come into play. You must also know the characteristic signs and symptoms of specific parasites. For example, pruritus ani, or itchiness of the anus, is very specific for pinworms, which you'll learn about later. And try to stay away from the non-specific or the constitutional signs and symptoms that almost all parasites would elicit, such as, for example, abdominal pain, weakness. So all our patients would eventually have weakness. So maybe it's high yield for you to understand specific characteristic signs and symptoms associated with specific parasites. As far as the life cycle is concerned, you will be able to see multiple variations of life cycles. The life cycle of your whipworm or your trichuris is very simple. It's a very circular, linear life cycle. On the other hand, there are more complicated life cycles, such as your Strongyloides life cycle, which have autoinfection, multiple cycles, multiple stages, and you have your ultra complicated life cycle exemplified by the most important parasitic infection in humans, the Plasmodium parasite causing your malarial infection. You have multiple cycles, multiple cycles, multiple cycles, multiple cycles within cycles, and the different life stages associated with them. At this point, you don't need to know all of these terms and all of these cycles yet, but when you go into the specific parasite discussions, please make sure that you know the life cycle of each parasite. Know the life cycle of each parasite by heart, by lungs, by spleen. The last point of discussion in this general orientation would be, again, some other terms, more appropriately discussing parasite epidemiology. So please try to understand the difference between prevalence versus cumulative prevalence versus incidence versus intensity. So prevalence would be individuals infected per total population, while incidence would be new cases per total population. Intensity, on the other hand, is worm burden per individual, and it is usually quantified. The unit of measurement would be eggs per gram of stool. It is also worth noting the different treatment strategies associated with parasite epidemiology. You have your selective treatment, wherein individuals are treated, targeted treatment, wherein at-risk groups are defined, and they are the ones given treatment or prophylactic treatment, and universal treatment. Then this is usually termed your mass drug administration, or MDA, which is a large-scale, population-based preventive chemotherapy. The picture here is a picture in Sarangani, Malalag Central Elementary School, wherein the teachers are the ones giving the elementary school students deworming drugs. All students, regardless of their infection status, are given treatment in the universal treatment strategy. Now, some parasites are best treated using the selective treatment approach, some are best treated using the targeted treatment approach, while some are treated using the universal treatment approach. Please try to think about these treatment strategies when we discuss the specific parasites. Lastly, you have to define the treatment goals for parasites. Elimination versus eradication. I leave that for you to research on your own. Know the life cycle of each parasite. As final words, I leave you this pathetic poem. We all live in one world, man, beast, and those in between. They may be just worms, just parasites to you, but understanding these bugs means respecting their niche, their place in your world. As small and insignificant as they may seem, they inhabit as much, if not more, space than we do. This is their world too. Thank you.